So hello and welcome to our TENF Healthcare Solutions webinar. Today we're going to be presenting on the new and improved Next-Gen Care Guidelines. My name is Chelsea Grover and I'm the Marketing Communications Coordinator for TENF. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. Next, for those of you who aren't familiar with TENF, I wanted to share a bit of who we are with you. We've been in business as TENF since 2003, but we've been Next-Gen users since 1997 EPM version 2.3. We specialize specifically in Next-Gen healthcare. Our development team knows how to get data into, out of, and around Next-Gen to customize it and tailor it to meet our clients' unique needs. Our purpose in life is to create delighted clients by helping them get the absolute most out of their Next-Gen software investment. It's our passion to provide solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. We really do everything Next-Gen, from consulting to hosting, customization to support, and we have two Next-Gen add-on productivity solutions, ChartGuard and Refund Manager. We're here to help. Next, I wanted to bring your attention to some of the upcoming webinars that we'll be offering. On April 20th, we'll be presenting Quality Care Program Reporting. So many choices, so little time. In it, we'll offer a high-level view of the most prevalent reporting programs available and go through what they are, what information is needed to report on them, and where that information can be found. You can either register now on our website or wait until the invitation email comes out from us later today. Okay, so going back to the webinar. At the end of the presentation, we're going to open the floor up to questions from you. We will answer all the questions at the end, but you may type them in the questions area of the control panel whenever they occur to you. And for your reference, we will also be emailing out links and recordings to the PDF of the presentation later this week, as we do with every webinar. Finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. So without further delay, I'd like to introduce our presenters for today, Lindsay Lanning, Cindy Kincaid, and Sue Campbell. Lindsay Lanning originally joined us from the Ohio State University intern program, where she was getting her degree in Health Information Management Systems. After graduation, Lindsay joined our team as the Healthcare Informatics Coordinator, where she spent her time immersing herself in the ever-changing healthcare IT environment and educating the rest of the company on new issues and trends in the industry. Cindy Kincaid is Vice President of Consulting Services at TENF and a Certified Practice Management Executive. With over 25 years in healthcare IT industry and 9 years with TENF, her experience is deep. This makes it possible for her to provide the insights needed to help healthcare organizations experience great success, no matter what the challenge is. Sue Campbell, who isn't listed in the pictures up there, I'm sorry, Sue, is the Special Projects Coordinator at TENF and an expert in everything Next-Gen. She will also be available to help with questions at the end. Sue has been with TENF for 9 years and specializes in interfaces and upgrades, and has worked in healthcare administration and IT industries for 30 years. Okay, so Lindsay, I'm going to go ahead and pass the webinar off to you. Feel free to get started when you're ready.
Great, thank you, Chelsea. Hi, everyone, and thank you for joining us today for our webinar, An Introduction to the New and Improved Next-Gen Care Guidelines. In this webinar, we will explore the key features of the Care Guideline system in Nextgen KBM, focusing on providing end users with an understanding of the workflow for care guidelines, as well as basic concepts about the system. Additionally, we will highlight information about the different care guidelines templates and how each is valuable to patient care. Together, we will explore the documentation benefits of using care guidelines, demonstrating the significant improvements that have been made. So in today's webinar specifically, we will look at an introduction to the care guidelines, which will include an overview of the new enhancements, followed by walking through the template basics, looking at both types, the grid view, which is what we're used to seeing, as well as the new paged view. Then we will delve deeper into the specifics of each template type, looking at the panels that are included in each, and what information and actions a user can take on each panel for both the page view care guidelines and the grid view care guidelines. We will look at another very important pop-up template found in the care guidelines, which is the Activate Clinical Guidelines template, where a user can manage the removal or restoration of guidelines, as well as activate new ones for patients. And we will finish up with the new, easier-to-use Care Guidelines Setup template. So let's get started. The new Care Guidelines enhancements include a new paged guideline management panel, a new setup template that contains a built-in frequently asked questions, and some important client-requested changes that have been included. Our practices can now have guidelines automatically applied if a patient meets certain age, gender, and diagnosis criteria, Changes to the guideline definition are automatically made for each patient when guidelines are refreshed. Guidelines will now pull from the lab module, and you are now able to create individual reminders at a patient level. Also, I wanted to point out this does not require 8.3.11. So what are some of the quality reporting benefits associated with care guidelines? Well, care guidelines are the easiest way for many clients to track and document numerous clinical quality measures, which are required for meaningful use attestation, PCMH certification, ACO agreements, and many more. Examples include quality reporting on health maintenance, such as mammograms and flu shots, and reporting on delivery of chronic condition care, such as A1C lab tests and eye exams for patients with diabetes. So let's look at the two types of pop-up templates available with the new care guidelines, the grid view template and the new page view template. These templates are used to handle health maintenance and disease management functions. Think testing, screening, and recommended care. And they are available from all specialty template sets. You can see the two views here. First, you have the grid view with the guidelines set up in a table. And then you have the new page view with guidelines set up in a list with the ability to go forward or backward between pages using the arrows at the bottom of the page. Just by looking at these two screenshots, you can see how different the layouts and functionality are, but both templates are showing you similar information, just organized differently. Let's first look at the page view template panels. The following panels are found on the Care Guidelines page view template. Clinical guidelines. This is where all active guidelines are displayed and where orders can be placed for testing and screening, and recommended care can be reviewed and updated. From here, individual guidelines can be modified. You can also launch the Activate Clinical Guidelines template, where risk indicators can be documented and guidelines can be activated or removed. And you can also track personalized guidelines and reminders. Recent orders. The user can review recent and scheduled orders and access other order templates. The metrics panel, where a user can view vital signs and lab results filtered by condition in a flowsheet format. And finally, the immunization panel, where you can view a patient's immunization history. Also, it's important to note that when Care Guidelines opens for the first time, you will see the page view with the Clinical Guidelines panel expanded. This is just the default setting when opening the guidelines. Moving on to the Grid View template panels, the following panels are found on the Care Guidelines Grid View template. Clinical Guidelines, again, with the same functions, but on the Grid View specifically, you can access the gender-specific risk pop-up template to document risk indicators for the patient. You can also access the Diagnostic History Entries pop-up template to document or review a history of diagnostic studies for the patient. Again, we've already talked about the recent orders, metrics, and immunization panels, which all have the same information and functionality we just went over in the page view panel descriptions. But unlike the page view, we have 4 more panels, which are vital signs, nutrition, drug therapy, and screening questions. Vital signs. A user can view vital signs entered during the encounter and can edit or review previously entered vital signs. Nutrition panel. A user can enter information regarding the patient's diet and nutritional supplements, review BMI value calculated from the vital signs template, and document that the patient was counseled on their dietary habits. And finally, we have the drug therapy panel and then the screening questions panel. The drug therapy panel, a user can review previous medications, filter the previous medication list by medication class, and provide indications of discontinued medications or reasons why a medicine was excluded. And then lastly, we have screening questions. On this panel, a user can view and document responses to screening questions. So after looking at the template types, let's take a step back and look at how a user can identify if a care guideline item is due. When a patient has care guideline items due, the active text link will display a red box with a number in it. This active text is found on the home page of a patient chart, as you can see in the screenshot. This number represents the total number of items required for that patient and takes into account any duplicates for more than one active guideline. What this means is that the number displayed on this box may not be the same as the total for the numbers displayed on all of the boxes for the guidelines listed in the blue panel of the Care Guidelines template. This is because one test may be a part of more than one guideline. As you can see in the second screen grab on the slide, the red boxes in the actual Care Guidelines template found in that blue panel add up to 10. But on the home page, we only see the number 9. This must mean there's a duplicate test required between health maintenance and diabetes guidelines. Now, to see what care guidelines are being monitored, the user can see the guidelines that are actively being followed for a patient in the left blue panel. Each guideline listed on this blue panel has a red box which shows the number of items that are due or recommended, but have not been completed yet. Any item that does not meet the status of due or not prescribed is not included in this count. So there could be many more items in the clinical guidelines panel, but the boxes will only show and reflect the items that are due or have not been prescribed yet. Now, for us to fully understand the functionality and workflow associated with the new Care Guidelines page view template, I'm going to pass it off to Cindy Kincaid, who will take us through this new feature. Cindy, whenever you're ready.
Okay, Lindsay. Well, let's talk about the page view template. This is where the activities for following a disease condition and or health maintenance during a patient encounter are performed. Some of these activities include activate new or update current active clinical guidelines for the patient as appropriate, review, place orders, and update the status of guideline items as appropriate, review and manage recent orders, review immunizations and track metrics, CQM checks, launch the Care Guidelines Grid View template, which provides access to additional information that the providers may be helpful, just as we somewhat talked about before. The page view template features include a number of different things. There are now only 4 panels which supports more streamlined navigation, and those include clinical guidelines, recent orders, immunizations, and metrics, with the default view being the expanded paged view clinical guidelines panel. There is a new iInfo button which explains how to use this template and launches a PDF document complete with the information and screenshots. Nextgen's doing a lot of those areas now where they can actually click on a button and it will give you documentation that helps you and guides you through the process. And I think that's something that was really useful within this one. There are also numerous filtering options using the show checkboxes at the top of the screen. In addition, it includes the ability to view up to 8 guideline items and recommended care items per page with arrows to go between the pages. So as you can see circled, this kind of gives you an idea of how the display will now show. There are checkboxes next to each orderable item so that the user can select up to 8 items and order all of the items at one time. You now have the ability to easily see the interval, start, and stop ages for an orderable item under each item as a blue active text link. It also provides the ability to click on an orderable view item and view the guideline that includes the test. Some of these features also include the ability to easily see what is due for the patient, as all due items will have a due date of today in red font with a yellow exclamation mark. This is a lot like the old disease management, and I know that from the cruisers we worked with before they introduced this latest iterative of the Care Guidelines really missed that. So they're kind of bringing a lot of that functionality back, and I think everyone's happy to see it. There is a status field to easily change the status of an item to completed, performed elsewhere, excluded, declined, due, or hold testing, as well as the last completed field to quickly update the last completed date if needed. That's added functionality so that you can close out the items that are due and mark them as complete regardless of how it is complete, because there are a number of ways it can happen. Sometimes the patient just simply doesn't want to do it. There are new comment fields for each orderable test or recommended care item that accommodates 100 characters of free text and carries forward until manually removed by a user. You now have the ability to sort each column by guideline, next due, status, and last completed by clicking on the column header. So they're moving that functionality that they have throughout the application into these care guidelines as well. You have the ability to create a personalized guideline by adding a single orderable test or test without having to apply an entire guideline to a patient's chart. So you've got a lot of options to do some things on the fly.
the ability to add free text personalized reminders with due dates, and the ability to task to a work group is also included. Clinical guidelines. Let's talk a little bit about what is a guideline. A guideline is a set of items related to health maintenance or a disease condition to be followed for a patient. And now we have guideline items. That is an individual item that makes up a set, and as a set, they are referred to as a guideline or clinical guideline. The clinical guidelines panel is where guideline items associated with chronic conditions or health maintenance are managed. This is where the majority of your activities are going to be performed. So in the clinical guidelines page view, when the clinical guidelines panel is on the care guidelines page view template, you can launch the Activate Clinical Guidelines pop-up template to activate clinical guidelines, document and update risk indicators, modify individual active guideline items at the patient level, see what the clinical guideline or multiple guidelines for an individual item is part of, add an individual orderable item to follow for the patient using the personalized orderables functionality without having to apply the entire guideline. And you can add reminders for yourself using the reminders functionality. That's really nice because you can set things up that you want to follow up on only, and you don't have to continue trying to keep track of them manually as you have had to do so in the past. So here's an example of the clinical guidelines page view. You can see the blue areas are the patient guidelines. We've got diabetes, health maintenance, hypertension, and osteoporosis. You can also see that there is a dental exam due today, and then you can add orderable or add update reminders at the bottom, and we have all of those circled in red. So that's just kind of an idea of how the flow is laid out. Okay, to work effectively with the clinical guidelines panel on the care guidelines page view template, it is to know what information is displayed and what functionality is available. Patient guidelines section in the left blue panel lists all clinical guidelines that are currently being followed for the patient. These are also called active guidelines. Red boxes next to each active guideline listed displays the number of items for that guideline that are due. And orderable items have a checkbox next to it. This checkbox must be selected to place an order for the item. The Place Order button remains disabled until you have selected a checkbox. Recommended care guidelines do not have a checkbox. Instead, they have goals. Let's talk about the information displayed. The Add Orderable Active Text link allowed you to add an orderable item to the list using the personalized orderables functionality. The Add Update Reminders Active Text link allows you to add or update a personal reminder to yourself about the patient using the reminders functionality. The Measure Status section on the left blue panel shows you whether you have met the criteria for meeting a clinical quality measure that you are tracking. The CQM check button launches a CQM check utility that allows you to check and update the status of the measures that are listed in the Measure Status section and update with any status details. On the Clinical Guidelines panel, this shows every item that is part of an active guideline. It shows up to 8 guideline items to display on a page. The navigation toolbar lets you easily view different pages displaying active guidelines items. For active guideline items, items are displayed in the following order. Active guideline items that are due are in alphabetical order. Items for active guidelines that are not yet due until a date in the future. Items for active guidelines that have been declined due to the due date will still display. And items for active guidelines that have been excluded, the next due date will be blank. The workflow on this panel includes 2 different types of tasks. Tasks you perform at every encounter with the patient, reviewing and updating status and goals, placing orders for testing, tasks you perform initially and later to only update with changes, documenting risk indicators and activating a guideline, tasks that you perform on occasion, removing a guideline or guideline item, reapplying a guideline in order to bring back a guideline item that has been removed. So the workflow summary, and that's for the Clinical Guidelines panel, it shows you the Activate Guidelines for the patient performed at the beginning, document or update risk indicators for health maintenance. Risk indicator health maintenance links can be found. So you've got your care guidelines grid view template or on the clinical guidelines panel. You can activate the clinical guidelines template on the active guidelines panel. You can review and update the status for items listed on the clinical guideline panel, such as a colonoscopy, as we have in the example here, and then you can say that it was completed and then was last completed. You can also review clinical guidelines for orderable items that are due, such as exams, labs, and diagnostic studies. So how do we activate a clinical guideline? On the clinical guidelines panel, you can click the Add Update button. The Activate Clinical Guidelines pop-up template launches. On the Activate Guidelines panel, click in the Condition field and select from the Pick list. If you select any other guidelines, you must also select the diagnosis that is to be associated with that guideline. Then the selected diagnosis code displays in the code field. You click Add, and now the clinical guideline is now active for the patient and the guideline items display. Once you're finished, you can click Save and Close to return to the Care Guidelines page view template. And this is just a demonstration and a screenshot of how you can activate a clinical guideline. So this just gives you the screenshots as we're doing the functionality we just described. Let's talk a little bit about personalized reminders. This functionality allows you to create and track reminders to yourself related to the patient. You can create a personalized reminder for anything that you wish to be reminded of within the patient's chart. Tasking allows you to send a reminder to your inbox. Reminders are then tracked to the Care Guidelines system and display in the left blue panel under the patient guidelines. And reminders do not print in documents. And I'm going to have a clarification. We went back on this. I believe the reminders do print in the documents. I think that's a typo. Let's talk about the Recent Orders panel itself. This is where you can view and follow orders for the patient. The Recent Orders panel grid is a workable, viewable grid only. No actions can be taken for items displayed in the grid from the grid itself. The Recent Orders panel grid displays completed orders or pending orders depending upon which of the tabs above the grid you select. So pending displays any orders that have not been canceled, deleted, or completed. Completed, I think, is self-explanatory. It displays orders for the patient that has been completed. The user can use the lab radiology order processing link or add standing orders and tasks by selecting the corresponding links. So while you can't necessarily do something from the panel, there are links that will take you to what you need to be able to do if you need to add any orders or process any standing orders from this area. On either tab, the user can click Edit to launch the order management template where results can be documented and orders completed. You can also select the Add button, which will launch the My Plan template where protocol orders that are due can be viewed and ordered by clicking the Protocol Radio button and specifying a time frame in which the protocols due in field. Now we can talk about the immunization panel. This is where a provider can view a record of the immunization orders for a patient, including status, date ordered, sequence number, and date completed. The immunizations data grid is view only. All immunizations must be ordered and managed from the immunizations module. Orders for immunizations are not displayed in the recent orders panel. The metrics panel is where a provider can view metrics for a patient, lab, and vital signs values for up to 10 rows of data. When you first open the Care Guidelines page view template, expand the metrics panel, it will appear blank. Flow sheets do not display until you select the guideline listed in the blue left sidebar under Patient Guidelines. Please note that a guideline must have metrics configured in order to have flow sheets display. Choices of categories for configuring the metrics include audiometry, lab test, vision screening, and vital signs. Data is displayed in the flow sheet format, and the metrics data grid is view only. So let's move on to the Care Guidelines grid view template. And Lindsay, I'm going to hand it back to you.
Great, thank you, Cindy. So the Care Guidelines grid view template This is the template many of us are used to seeing, and not much has really changed here. The grid view displays only those items that are due for the patient. It offers basic functionality for activating and tracking guidelines for the patient, and it provides access to additional information that providers may find helpful. So you can choose to open the original grid view template and effectively switch from the page view to the grid view by clicking the grid view active text on the clinical guidelines panel of the page view template. You can see the pop-up template will open. And the first indicator that you're looking at the grid view versus the page view before you even expand the clinical guidelines is the number of panels. We went over that the page view only has 4 panels, while this view has 8. So the panels we already covered while going over the page view were recent orders, immunizations, and metrics. So we won't touch on those here. Instead, we will start by looking at the other 4 we didn't see on the page view, and end by looking at the clinical guidelines panel, which is the main difference between these 2 templates. So first off is the screening questions panel. This is where you can view and document patient responses to screening questions related to a condition or disease. When you first open the Care Guidelines Grid View template and expand the Screening Questions panel, it appears blank. Questions do not display until you select a guideline listed in the left blue sidebar under Outstanding Guidelines. Note that a guideline must have screening questions configured in order to have screening questions display. And not all guidelines have screening questions configured, so don't be alarmed if this is blank even when you select a guideline in that left blue side panel. Next is the Vital Signs panel. This is where a provider can view vital signs documented during this encounter. Previously entered vital signs can also be edited or removed, and new vital signs can be entered. The Vital Signs panel is also found in other office visit templates. The Vital Signs templates are based on age, depending on whether the patient is less than 2 years old, equal to 2 years old, or greater, or an adult. And the template's display name varies accordingly. The Nutrition panel is where a provider can enter information about the patient's diet and nutritional supplements, review the patient's BMI value, which is calculated on the Vital Signs template, and document that the patient was counseled about their dietary habits. You can see where all this information would be documented from the screenshot provided. And then we have the Drug Therapy panel. This is where a provider can review and enter information about medications that have been prescribed for the patient and discontinued. Medications displayed in the Drug Therapy panel grid are those medications for the patient found in the medication module. Medications displayed in the grid can be filtered by medication class. Lastly, we have the Clinical Guidelines panel grid view. The Clinical Guidelines panel on the Care Guidelines Grid View template displays active guidelines that are due for the patient in a data grid. To see the details for a clinical guideline item, highlight the row in the grid. Details for the guideline items display in the field found above the grid. And if we take a look at that description here, you can see I have depression screening highlighted in the grid, and all the corresponding information is found in that area above the grid. So to touch on a brief workflow summary for this specific panel, which is similar to the one we just saw for the page view. First, you'll need to activate guidelines for the patient, and this is performed one time at the very beginning. Next, document or update risk indicators for health maintenance. Review and update the status for items in the grid using the fields found above the Clinical Guidelines panel grid. And lastly, review clinical guidelines for items that are due, such as labs and diagnostic studies. The status displays due, and orders can be placed from the Clinical Guidelines panel data grid. So if we take a closer look at step 3 in the workflow, review and update the status for items in the grid. Guideline items that do not display the status of due in the grid are recommended care and are not addressed at a specific time interval. These listed items serve as a reminder to update the status for these listed items, just serve as a reminder. To update the status for guideline items, First, highlight the item in the grid, then select the status, and a pop-up window will appear, and you can choose the status you would like this item to have. So the options you can see include completed, performed elsewhere, excluded, declined, or hold testing. And then click Close and Update. And to finish up this section on the grid view, we will look at step 4, where the user placed an order for items with a status that displays due. These items are sometimes referred to as protocol items. Protocol items require orders and typically have a specific time frame attached. To place orders for protocol items, highlight the item in the grid and click Order. This is different than the process for the page view, where you click checkboxes and then order multiple at a time, but the functionality still exists, just with a little less ease. Now onto the Activate Clinical Guidelines template, which can be opened from the Page View Care Guidelines template by clicking the Add or Update button. We looked at this panel briefly to go over the actual process of activating a guideline, but there are many other tasks that can be carried out from this template. And I will turn it back over to Cindy Kincaid to walk us through these tasks. Cindy, whenever you're ready.
All right, I'm just going to check to make sure everyone is still awake out there. This is pretty dry material, and I know that we're going through a lot of data. We'll have time for questions at the end. So right now, though, we're going to move on to talking about how you activate the Clinical Guidelines template. The Add Update button on the Clinical Guidelines panel opens the Activate Clinical Guidelines template, where you activate or restore guidelines. Tasks carried out on this template include removing a clinical guideline or guideline item, bringing back a removed clinical guideline or guideline item, viewing clinical references for guideline items, adding a diagnosis from the patient's problem list to the patient's ICD billing list, reviewing clinical guideline history for the patient. Activating a clinical guideline is performed initially, usually only once. The guideline must be activated before it can be followed by the patient. So, clinical guidelines for health maintenance or a disease condition that you want to follow for a patient must first be activated before you can use the care guidelines system with the patient. Guidelines are activated on the Active Guidelines panel of the Activate Clinical Guidelines template. Activating a clinical guideline is performed initially, usually only once. If you attempt to activate a guideline that has already been activated, you will be asked if you would like to reapply the guideline. And if you elect to reapply a guideline, it can be done if certain items within the guideline are not being followed, and now you wish to add them so that you can now follow them. If you want to remove or restore guidelines, guidelines that have been activated for a patient by mistake can only be removed in the same encounter in which they were activated. You can't do it from anywhere if you discover it a few days later. The time to remove an entry or any individual guideline item is before you have started using it. Once you have data attached to the guideline or guideline item, you will not be able to remove it. A guideline item that has been removed can be restored by reapplying the guideline that activated it for the patient. This means activating the guideline again. When you reapply a guideline, the system will go through all of the existing items that are active and then will only reapply the one that is missing from the set for the condition. The Remove Restore Guidelines panel on the Activate Clinical Guidelines pop-up template is where you can remove individual guideline items or an entire clinical guideline by disease condition. If you change your mind, you can restore the guidelines that have been removed. So you can take them out and you can put them back. You can remove an individual guideline item that will not be followed while the remaining items for the guideline are followed for the patient. So if you have something in your overall clinical guidelines and you need to remove an individual item, you can do that if it's not applicable to the patient. If you want to review the clinical guidelines history, you have that option. A history of the clinical guidelines tests or exams can be reviewed on the Clinical Guidelines History template. This is where you can see all guideline items that are completed and are no longer due. The template can be launched from 3 places: the Clinical Guidelines panel on the Care Guidelines page view. You can also do it on the Care Guidelines grid view, and then Active Guidelines panel on the Activate Clinical Guidelines template. Here's just an example of the clinical guidelines history, and you can see the guidelines that are displayed, and then how you can see all of the history in the grid. There are now some web-based features, and how you can activate them is in the Activate Clinical Guidelines template. You can highlight an item on the grid and click the web button in order to access the corresponding web-based clinical reference material. And this is something that I think has been really well received by the few groups that we have using it, and we'll talk a little bit more about that as we move forward. Although this is just a really nice functionality and gives a little bit of ability to provide additional information to the patient when you're discussing their care guidelines. As we move to the care guidelines setup template, we'll talk a little bit about how you put this into your system. So let's move on to this template. All right, a new consolidated care guidelines setup template has been created to ensure that the setup and maintenance of care guidelines is a lot easier than it has been in the past. Some of the features of this new template include 4 panels arranged in the order needed to either set up custom guidelines or maintain or alter the out-of-the-box guidelines. Active text links that allow you to quickly access the following practice templates that might be used in conjunction with the care guidelines you're choosing: medication classes, diagnosis groups, reference systems, and recommended care. It has an easy view of the file maintenance mappings for the tests that are currently mapped in the Order Nextgen Healthcare Test Compendium table. It gives you the ability to copy care guidelines setup to other practices or opt out at the practice level of recommended care. It includes meds and recommended care and non-meds. It also gives you the ability to create or modify existing guideline conditions and reasons. It includes the ability to set guideline condition reasons to auto-apply based on parameters defined by the practice, such as interval, start, and stop ages. It includes the ability to easily associate a number of items to either an out-of-the-box or custom-created guideline condition reason. As we continue with care guidelines setup, there are 4 panels: define guideline reasons and auto application, orderable test setup, test equivalents and alternatives, and then frequently asked questions. Active text links to access guideline-related system practice templates include medication classes, diagnosis group management, recommended care, and you now have the ability to copy care guidelines setup to other practices, opt out at the practice level of recommended care, and opt out of recommended care non-meds. So as we define guideline reasons in auto application, you can now create new or modify existing guideline conditions and reasons. There is a checkbox that allows you to set guideline conditions reasons to auto apply. When you're setting up your orderable test, you now have the ability to easily associate new tests, instructions, exams, office medications, office procedures, office labs, immunizations to either an out-of-the-box or custom-created guideline conditions reason. Test equivalents and alternatives give you the ability to easily associate test descriptions and or test codes that are an exact match to a test name, test equivalents. It provides the ability to easily associate test descriptions and or test codes that are not an exact match to a test name, but are an alternative test that a practice feels would also satisfy the test. Gives you an easy view of the file maintenance mappings for the tests that are currently mapped in the Order Nextgen Test Compendium table. It also provides the ability to verify during setup if a test equivalent or test alternative code has a valid SIM code. Frequently asked questions, it gives you the ability to include frequently asked questions and look at most commonly asked questions answers regarding setup and use of care guidelines. Includes printable PDF document attached with the additional information and helpful screenshots. And again, remember, you are configuring these based on what you're doing, so you have flexibility even with the FAQs. As we move forward and as we get to the close of this, items to consider. There is a warning in the install guide that when you auto-apply 5 or more care guideline conditions in the system template, there may be an impact on performance. Because of the fact that this is a relatively new module, it works with a lot of different Nextgen KBM versions and hotfixes. So you don't have to be, as we talked about before, you don't have to be on KBM 8.3.11. You don't have to be on KBM 8.3.10. You can do it in any legitimate KBM, from 8.3.8 on up. So what you have to consider here is that, there's so many variables, and many of the groups that we're working with and talking to about this, and the couple of groups that we have put it in, are probably not going to jump straight to the 5. They may start incorporating these into prod a little at a time to see what the performance impact is because of this warning. Bottom line is we just really don't know the answer to how it's going to impact, and it could vary even from your KBM version. When you auto-apply a guideline, it applies patient by patient and does not apply until you go into the patient and open either the SOAP or intake. Another consideration is the user now has the ability to order labs, test, and send right from the Care Guidelines template, which sends them to the order module for processing. It is important to note that this does require Nextgen compendium mapping to all labs, which the Care Guidelines test may be ordered from. You must use the Nextgen compendium in order to utilize this functionality. This will also require someone to open the lab radiology order processing template after the order is placed in Care Guidelines, select the vendor, and push the order to the orders module. So it's not a one-stop shop. It still gives you the ability to do that, and as long as you incorporate all of these items into your workflow and incorporate the Nextgen compendium, you're good to go, and it is a very nice feature. Just keep in mind these items. So let's talk a little bit about the client experience so far. Currently, we have a few clients who have implemented this. Some have it in test environments, some are still looking to move it into prod, and others we're just getting it scheduled and playing with it. We also have it in our own environment at iTentive. Basically, the feedback we have received from the providers who have been trained on it and are going through the testing process, they really like it. As I said, it goes back a little bit to like the disease management, which was something that everybody sorely missed when it changed a few versions back. However, there is a list of, so far, of 16 known issues associated with this release of Care Guidelines. So if you're going to be moving forward with this, check it out. So make sure you take a list of this to see if you are affected, or if you already have it in test and you're looking at some things and you're seeing some problems, be sure to go take a look at this. We just included a couple of these issues so that we could talk through them. There's a known issue, KI91707. The metrics panel does not refresh on the page view, only on the grid view. Known issue K196073, comments entered on the paged view don't print on documents. Known issue K196105, recommended items marked as counsel do not appear in the master IM document. And known issue KI96076, reminders do print on documents. And that goes back to the one that we had it both ways in one of the earlier slides. So as we wrap up our discussion on Care Guidelines, I want to just kind of cover a few things. Many quality reporting and issues are supported by this release. I know at UGM everybody was excited it was coming out, and we were really happy to see it, and it got a little later than it was, but I do think even with some of the little challenges that we've seen so far, it is has been worth the wait. Care Guidelines page view overview. You now have 4 panels, info button, numerous filtering options. There's 8 items per page. You can order multiple tests, easily see when a test is due. It includes personalized reminders and recommended care. In summary, the Care Guidelines Setup template provides 4 panels. They're arranged in the order needed. You can set up custom guidelines, and you can maintain or alter out-of-the-box guidelines. We also provided a list of the Nextgen Care Guidelines resources. In the Nextgen Success community, there's a Care Guidelines 1.0 article, overview article, where all of this information that we've had in the webinar can be found. It contains executive summary, release notes, setup guide, user guide, various white papers. We've listed all of them. I won't read all of them. And this gives you an idea of where you can go, that if you want to move forward with this, it's a really positive, I think, step. And the fact that you don't have to do a KBM upgrade, although there is some KBM work that needs to be done. And we'll talk a little bit about that if you have any questions as to how that process is done. Sue is the person who has installed it for our clients in all cases, and we'll come take you through that as we move forward with our questions. So as we prepare for questions, let's see, if you're uncertain where your practice stands, let iTennis help by assessing your current readiness. We can provide recommendations. on implementation of new processes and procedures. We can also help you with any installations, upgrade, hot fixes, anything that you would need us to do if you don't have the resources or you're just looking for assistance or even advice. And if you want to take advantage of some of these items, your next steps would be to visit us at itentive.com, sign up for our informative webinars and blogs. We have webinars, we have newsletters that go out every week, and we'll be happy to include you on those. We'd also like you to consider our 3-day fixed price on-site consultations to review clinical workflow, revenue cycle and front office, technology and performance. We also offer some security assessments and things that we can help you as we're getting into the HIPAA audits and there's been regulations come out. And we would also invite you to test drive our products, which you can make arrangements to do that on the website. So now let's get to our questions. And
wow, thank you, ladies.
Sue are available.
Yeah, that was so much information, and we have so many questions, so get ready. And again, if you have any questions, type them in the questions area of the GoToWebinar control panel. And we're just going to go through them in the order that they came, so some of them have probably been answered throughout the presentation, but it doesn't hurt to go through the information again. So first question, which KBM is required?
I have that one. Yes, I have that one. There really is no KBM required. It's available on all KBMs. I would say, you know, we have tested it. I believe, Sue, from your perspective, I think any solid KBM from the 8 series and up is going to be acceptable. I'm not sure you can go back as far as say 7.7, but you know,
no.
Yeah, I think it's got to be the 8
I
and
believe
higher.
8.3 may be required. Let me verify that for you.
Yeah, I don't know of anybody that you know would be on any. I do know it has to be a legitimate KBM 8 series. Who can verify that while we're going through? But 8.3 was the first one after you moved from the 8.0 environment. That was really where all of this functionality started taking place.
Okay, great. Then we'll return back to that one in a few minutes here. When you personalize the guidelines, can you say the patient met a guideline and they will be exempt due to something, thereby deactivating that metrics? For example, bilateral amputee no longer needs monofilament exam.
I can grab that one.
Okay.
My understanding of it is, yes, that this is completely customizable. It's supposed to be extremely user-friendly. You can definitely personalize that guideline item. In regards to changing it to have it say not being needed anymore, that would just be changing the status of that and going through. But yes, the personalized reminder can be added to that, and then I would just go about changing the status to completed or not needed or excluded.
And also remember that you can remove individual items. So in the particular case, if a patient is you know has had something that has changed, particularly you've got a certain type of guideline in you know gynecology where that you've got a patient who's had a hysterectomy, that might change some of the guidelines and needs that they have, just as the example that was given of an amputee. So yes, the answer to that, in my opinion, as Lindsay said, is yes.
Great, thank you, ladies. Next question. One day when the grid view is no longer supported by Nextgen, where will users document screening questions?
As of right now, I mean, going along that, the grid view is still the active text. I mean, I think they're keeping it on there because users do like that. As of right now, the grid view template does offer some extra information like the screening questions. It also offers some active links like the diagnostic histories that the current page view does not. So I don't see Nextgen going away with that anytime soon just because it has some other extra information. I don't know, Cindy, if you want to comment on that.
I don't know that we have the answer to that, honestly. I know that there's been a lot of discussions about the grid views, and I know that in theory it is going away. Given that they have not moved everything to the panel view in this particular scenario, I think it's going to be around a while. I don't know that I can answer how they're going to adjust it when they actually finally do make it go away. So I think the official answer is we don't have the answer to that, and I'm not sure anyone but Nextgen does.
Okay, thank you. Next question. We have used health maintenance in version 7.x in the past and stopped using it. Now we'd like to use only the health maintenance section. Can we remove the other guidelines for all in the background, or is this per user?
My understanding is it can be configured per practice, which would be if you're a single practice entity. I don't think you have to do this per user. That's not my impression at all. I'd want to know a little bit more about what you're doing specifically to give you, incontrovertible advice, but my answer initially would be that you can do this by practice. It does not have to be done by user.
Okay, thank you, Cindy. Next question, reminders. Oh, this isn't the question, this is a reminder from one of our attendees. If added to a patient that can be viewed by all staff or only the staff who added the reminder, notice personal was used several times in our screenshots. So just a helpful reminder, thank you. Next question, orderables. Does it give you the ability to send a task when placing the order?
I don't know the answer to that, Sue.
It does. It does.
Okay.
It does allow you
Yes.
to task in task work groups now.
Yay. Okay. Do the screening questions pull over to the SOAP note if it's during an office visit?
I believe yes. I guess I can't say I'm 100% sure on that, but the main thing is that the main change here that we've seen with both of these templates is that they're able to talk to all the other templates, and they should be pulling information, and that should connect, and that information with the screening question should pull over and transfer over if you actually document directly into that panel.
And
Yeah, I would agree. Oh, go ahead, Sue.
Oh, I was just going to say I agree with Lindsay also. However, I will tell you that some of the known issues have to do with your documents. So you're going to want to make sure when you pull this in that you're testing carefully, and you make sure that what you're documenting is pulling over, to your documents.
Cindy, anything to add?
I was going to just clarify again, make sure to look at the known issues. Documents are always kind of the touchy area. And so, again, agree with both what Lindsay and Sue said.
Okay.
This is still relatively new, so some of these things, honestly, you're just going to have to test as we dig into it. I think everybody knows it came out. We've only got a couple of people that are using it so far and, taking it slowly. So a lot of it is going to require testing, and I can only emphasize a lot that when you deploy this, Sue can kind of talk to how it goes into your database and what the process is for upgrading and that kind of thing. I want to call it an upgrade for installing it. With that said, I can only emphasize, as always, test, test, test.
Great, thank you all. Next question, and this one's to Cynthia. When entering hospital data, such as patient had flu shot at Walgreens, is this data mineable, i.e., can you run a report?
Well, wow. Okay, to answer the question, yes, you can run a report if you are putting it in the care guidelines and documenting that you have completed it as we displayed, as we showed in the slides. All of that's going to be reportable. Now, to what level it's reportable, I need more information about what you're trying to accomplish. My instinct is yes. Sue, if you have anything to add, because I know you dig into this pretty deep, as long as you're following the process and you mark this as completed with the date because it was in the care guidelines, then yes, it is going to show that it's completed and you can pull it out. Now, you may have to use a custom crystal report as opposed to a standard Nextgen report. Again, depends on what you're trying to do and what level of report.
Right. Right, and I know on the immunizations, when you're completing one of those or ordering one of those, that's going to take you right to the order module. So any of the, unlike there's no Nextgen compendium mapping, obviously, with your immunizations. So it's going to take you straight to the order module so you can report on it in the same way that you would report on any immunization that you would.
Right, and then just mark it that it's, I think the question being that it was completed at Walgreens and the patient's just notifying you, but the process is really the same.
It is exactly the same. So
yeah,
in that case, really you would use historical immunization, but you're still going to do it in the order module, which it'll take you straight there.
So just follow the guidelines, and you should be able to get it out.
Yep.
Okay, when you order a guideline that is protocol from the grid view, does the order show in the orders module?
I can grab that. Yes, it definitely does. They now talk.
It's not going. I'm sorry. Go ahead, Lindsay.
Go ahead. No, go ahead, Sue.
It is not going to go to the order module. It will go to order management, but those are two separate. We're talking about order management as a template, and they will all show up there. It is not going to get to the, if you're ordering a lab or a radiology test, it will not get to the order module unless two things happen. The first thing that needs to happen is that you would have to have that, it's only going to pull up Nextgen compendium codes for you. So if you actually want this order to go out the door through the order module, if you have interfaces, then it's going to have to be your Nextgen compendium code that you choose will have to be mapped to your radiology codes, to your, you've got LabCorp, you've got Quest, whatever, that all has to be mapped. The second thing, in order for this to get to the order module then, let's say your provider selects it in the care guidelines. It's like with any, if you're using the Nextgen compendium codes now, you know this process. Somebody has to come behind the provider, because I haven't ever seen a provider do this, and go to the order module processing template and select a vendor and push it through to the order module. It's not going to go through to the order module without those, well, it can go to the order module without mapping. It will not go out through an interface if you have those, unless you've got the mapping done also.
Okay, thanks, Sue.
Mm-hmm.
Next question. Are the web materials printable, and will this feature meet meaningful use objectives to patient education?
I do not know if Nextgen has linked this to their patient education results, because as you know, you basically have to use the patient education document. You also have to go in and check in the patient plan. So honestly, I don't know if this meets the meaningful use education requirements or not. I don't think, to my knowledge, and I haven't read anything about it in the documentation or even looked at it as we've installed it. Sue, Lindsay, if you can add to this, I haven't read anything that this is altering what you do for meaningful use.
Yeah, after going through the user guide and setup guide, I did not see anything that mentioned meaningful use, which I think it would if it did count.
It's a reasonable question. And again, as long as you can get it to populate the areas that Nextgen reports are pulling when you're using the HQM, then it can. I mean, we've had, patient education is patient education. So let's make a note to follow up on that one, because I'd like to get the answer to that. I don't know, but I can't. It's a really good question.
Perfect. I flagged that one for follow-up. Next question. So if you have a guideline, for example, hypertension, that the patient has overcome by diet and exercise and does not have hypertension anymore years later, can you stop using that guideline?
Yes. I would have to go back. Basically, you have the ability to remove a guideline, and I think it was specifically for that particular area. You could resolve and remove guidelines. So yes, you can stop doing it and reapply, I believe is the term.
Okay, great. Next question. Oh, nice facts. Somebody liked the FAQ option feature. So yay.
I like that
too. Another question regarding the Nextgen KBM version. Do we have an answer on that one yet?
Yes, you need to be on any version of 5.8, and you do need to be on KBM 8.3, any version. Doesn't matter which one. But if you're still on 8.0 or 8.1, you will not be able to implement this at this time.
Great. Thank you, Sue. Thanks for that clarification. What system practice templates do you configure the matrix from?
I'm looking. Lindsay, can you get to that slide?
I think that it was around slide 56 was when the question was asked.
Yeah, I'm looking. We'll look that up and get back to you. I don't know that I have the exact name of the system practice configuration in the grid, and I know I don't have it memorized yet. So
Okay.
Right
so I get one.
we will definitely follow up with everyone on that one.
Yep, sounds good. Okay. And just so everybody knows, if you have to duck out, like I said, I will be sending out a copy of the slides as well as a recording, which will have all the questions at the end. So if you have to duck out, I know that we're over our time. You can still get the answers to the questions that have been asked in a couple of days here. And our contact information is up there as well, so don't hesitate to reach out to us that way. Next question. Is it true that patient-level interval modifications on service times are locked, return to configured default, when implementing the GC standalone application?
I'm actually looking for that question. I'm scrolling through the questions because I need to read that one.
It was done at 12:46.
Okay, thank you.
Mm-hmm.
I will have to follow up on that one because I can't find it, and I need to read. I'm scrolling through them, and I don't have a 12:46, so I apologize. Oh, you know what? I'm on Eastern time. I'll tell you what. Let me look for a 146. Okay, got it. I was like, okay, I don't have a 12:46.
And then in the
You know what?
meantime,
I think the answer to that is yes. We're going to confirm that, but now that I'm reading it, the question is it true that patient-level interval modifications on service times are lost, return to the configured default when you first implement the care guidelines standalone application? And I think that may very well be the case. As I recall something that I read. Sue, do you remember anything about that?
You know, as I talked with Ann yesterday, she did mention that if you're using the current care guidelines, you're going to want to check carefully once you install the new ones, because what they have seen is that sometimes it didn't address the interval modifications, but she did indicate that they did see some changes. She said they're easily corrected, but when you implement this, you're going to want to compare your old care guidelines to the new ones to make sure that you either haven't lost data or gained data. Apparently, they had gained things that they didn't think should be there.
Read that, so I believe the answer to that is true. I don't know that it's cut and dry. And again, remember, we got a lot of different KBM. You know, there's a lot of versions between 3 and A311. There's just a lot of hot fixes and a lot of different things. And you know, a lot of variations of any version of 5.8. So these can behave differently depending upon what version you're on. I mean, wouldn't you agree with that too? And you know, there's just not enough data out there to say. But I have read that, so thank you for that clarification. Yeah, I believe that is true. So you'll just have to check that.
Okay, thank you.
Right.
If data is entered in the clinical care guidelines panel or the grid, is that reportable so we don't need to enter the data elsewhere?
I think again that.
Yeah, I'm going to answer yes to that, depending upon that's not a lot of information. Now that I'm reading these, I'm actually caught up with everybody. That's not a lot of information, so I don't want to say that it's elsewhere because that's all encompassing. It would depend on where you want to report it from. I mean, wouldn't you agree, Sue?
Yes, that's exactly what I was going to say. You know, how you need to report that and where you want to pull it from. It is included on various templates, and it's and we're supposed to copy forward. I will tell you that's another one of the known issues, that there may be some issues with copy forward from the care guidelines. So that's another thing you're going to want to keep an eye on when you're testing.
Okay, thank you, ladies. We have KBM 838. I don't see an option for the paged view.
It could be a configuration issue. It could be, I mean, there's no variation in this. If the question is, there's no variation of this from version to version. Now, I do see in this same one, it says we've been using care guidelines since September 2015. On a couple of occasions, nurses assigned conditions in error in the old and did not catch the error until the patient returns. We have been told there is no way to remove this from patient's chart. With version, is this possible? One of the patients this happened to. So I'm not going to read the entire area, but basically, once you have documented, if you have documented anything into it, so you can assign a care guideline, and you can remove a care guideline as long as you go back to the application. However, if you have entered data in the care guideline itself, you cannot remove it, and that is in this version as well. And I hope I stated that properly.
Can you restate that one more time, Cindy?
Okay, basically, if you have added a care guideline on a patient, or you've applied it to a patient, but you have not added any data to that specific care guideline, you can remove it. If you have added data, which in this particular case, it seems like it was, the scenario that has been described here, then if you've added data to the care guideline, meaning you've marked it as complete, you've marked the test complete, you've incorporated data to the care guideline, you cannot remove it. And Sue, Lindsay, did I say that clearly? Because this is kind of a pretty big question.
Yeah, it's kind of hard to explain. But no, you're on the right track. I mean, really, it just comes down to if there's data associated with a clinical guideline, with an active guideline, you're not going to be able to remove it. And you're not going to be able to remove it unless it's in the encounter you created it. If you haven't, if you added it accidentally, and you're in the same encounter and there's no data pulled or attached with it, then you should be fine to remove it. And you can restore it at any time as well.
Okay, thank you.
I want to go back a little bit more in that question because I'm reading it again. There was a lot of data in here. I can't answer the question as to why you do not have an option for the page view. I'm assuming that you have installed the new care guidelines, because it's immediately followed with we've been using the care guidelines since 2015. If you have installed the new care guidelines and you do not have the page view, check your configuration and your setup, and then I would log a ticket with Nextgen.
Okay, thank you, Cindy. Will old guidelines pull into new templates? If not, what's the best way to get historical information onto the new guidelines?
They are supposed to, but I think that goes back to the question we answered earlier. You need to test this. There are some known issues with this, and there's also some areas that they talked about that things are data is disappearing or they're getting more. So back to the old adage, test, test, test. In theory, it is supposed to if you read the documentation.
And my understanding is that actual patient data, I was referring more to the to your configuration, right, to what what orderables you have, that kind of thing. My understanding though is that patient historical data, I have not heard anyone say that that is not pulling forward when you upgrade. I think we're okay on that one. If that's if you're referring to actual patient data.
Yeah, I would still test it. Because the care guidelines, and again, version to version, again, it's too new, so some of the stuff we're hearing, some of the stuff we're reading, some of the stuff you're seeing on Yahoo user group, you don't know whether it's user issues, you don't know whether it's upgrade issues. I would test it, but it is supposed to be there. And if it's not, definitely log a ticket or let's figure out what's wrong.
Okay, thank you. Next question. When we pull these due items, will they automatically pop up when the chart is opened, or do they have to go into care guidelines first to see the alert that something is due? Want me to reread that?
No, I'm reading it.
It's not
again,
on the
I
list.
think that's
It
some,
was
I think,
it was
oh,
chatted to me.
okay.
So when
then,
we
yeah,
pull these
I was
items,
trying to find it.
yeah, I know you were.
Sorry, I actually started answering the question and I was muted. I was just going to say that when you open the care, if you open the care guidelines as part of your regular workflow, it should just show with that yellow exclamation point in that red font that we showed on the slide
Right.
with the due date of
the
today.
question was, do they have to open the care guidelines to see them, or will they just automatically pop up when the chart is opened?
No, it's not like an alert. Now there are spots now in Nextgen where you have alerts in your ribbon and different things. So some of these items will be visible, and there are some things that I believe go onto the telephone or the new communications template. But it's not like it's just you go into the chart and you open it up, and no matter where you're at, it's gonna pop up, and it's not like an alert that's gonna override what you're doing. You do need to be aware that you're following care guidelines.
Okay, thank you.
There are little spots of it, though. I don't want to make it sound like that there's nothing that it shows, but it's not that the template itself is going to automatically launch.
And when the items are due, you'll see with a little red badge icon next to the care guidelines with a certain number with the items that are due from the home page.
Okay.
So you will have some indication.
Do we have to structure the guidelines with a diagnosis code, or can it be set up by age, sex, vital signs, etc.?
It's a combination. I mean, there are some guidelines. It's a combination is the best way I can say it. I believe you have to have a diagnosis code. I don't know if Stu or Lindsay are looking, but it is also set up by age, sex, vital sign. Again, certain criteria can be done. So I've got to.
I don't believe a diagnosis code is required.
Yeah, that's what I'm trying to say. There are certain types that have it when you set it up and you launch certain tests. So it's really got to do with the guideline as a whole. But if you're just looking for, say, a mammogram, or a female that turns age 30 to have their first mammogram, no, you don't have to have a diagnosis.
So it's a combination of both, basically, depending on what kind of a guideline you're going for.
Well, it's how deep you're going with the guideline. I'm going to answer to this. Do you have to structure the guidelines with a diagnosis code, or can it be set up by age, sex, vital signs? No, you don't have to have a diagnosis code, and yes, it can be set up by age, sex, vital signs. If you're ordering tests or anything, then diagnosis codes are required because they're required as part of it. So that's what I meant by both. But if you're just looking to be able to set that you're following certain criteria, then no, you do not have to have a diagnosis code.
Perfect. Okay, thank you. Next question. Let's see. Would you know if it's applicable for ophthalmology practices?
It can be used for ophthalmology practices. Again, applicable is pretty broad. There are things that you can do from an ophthalmology if you're running certain care guidelines, such as diabetes. I went to an ophthalmologist recently, and they told me the eyes are the place to the soul, so they can monitor if you've got diabetes and other things. So it depends on what you're doing in your practice, but yes, I could see it being useful. I don't know that it's required. And you do have the ability, again, to make some modifications to it as well. It depends on what you do.
And you can also create a whole new care guideline, which is nice. So if there's something that you need to track in an ophthalmology group that's not already addressed in here, you should be able to get that set up.
Great, thank you guys. Do you know if it impacts current care guidelines that are already set up in the EHR?
I think that we maybe all have already addressed this. If you're talking about the patient data that's in an existing care guideline, it should move forward. So no, it shouldn't, but I would test very accurately. If you're talking about the care guideline criteria that you have set up, I think that's also what Sue was referring to, that some of these have not carried forward appropriately. I believe that's what you're asking, and so the answer is technically it's not supposed to, but you need to test. And Sue, would you agree with that?
I would. And it's just a matter, you're just going to want to compare your current guidelines with what you get in your test environment when you upgrade to the new guidelines. And again, that's the bad news, that you have to look at it at all. It'd be nice if we could count on that. But the good news is very easily resolved, but you absolutely do want to compare them, because we have seen instances where things have either been added or missed.
Great. Does it require UD2?
No.
No.
Easy answer. I like it. Will users attached to providers be able to order and add recommended item statuses? Can you access these from a chart update visit type?
Yeah, I don't see any reason why you shouldn't, because once you get your chart update visit type, you open, and then you've got your care guidelines panels on the left.
And that was a two-part question. Will users attached to providers be able to order and add recommended item statuses?
If they can add them today, they can add them then. It's kind of the same. It's kind of the same thing. You can go into the chart update, and you can do anything that you are able to do now, is provided you're able to do it and you have the security to do it today. Now, if you can't do it today, this isn't going to change that.
Okay. Next question. When updating, does data move from the old guidelines?
Yes, but test to make sure it does.
Yes, but test. Okay. Does the reminders in the care guidelines count for meaningful use?
I think we had that one also earlier. To me, it should. I think it does, but we're going to double check that, because it really has to do.
Sorry, Cindy, just to jump in here, I don't believe it does, because it needs to be suggested by the EHR, looking back at the actual objective and measure, and I wouldn't constitute this as being suggested by the EHR downloading it. Again, we can double check for meaningful use.
Yeah, that's an interpretation, though, Lindsay, and I agree with your interpretation, but let's check with Nextgen, because this is really about how Nextgen reports, regardless of how any of us interpret it. I have found that with meaningful use in the way that Nextgen HQM reports work, that sometimes that we are all, I think everybody on the call sometimes can be on a different page as to what we think. So we really want to make sure that because even if we did think it did, and I agree with your assessment, by the way, even if we did think it was, Nextgen maybe disagrees, and it's really how they work their reports. So let's just research all those meaningful use questions.
Yep, I have flagged that one, and we will follow up probably next week with that. Next question. Why can you only task to a work group and not an individual? Why can't I task a reminder to myself or an individual? The guide says you can, but the pop-up only shows work groups. I'm not sure how often I would want to send a reminder to an entire work group.
Okay, I can't answer this because I don't have access to your system exactly. I can tell you I have instructed people many times how to task to an individual, and normally it only pops up with your work group, and I'm assuming we're talking tasking from the EHR in workflow. And usually if you just leave that blank, it will say, do you wish to send this to yourself? It's not going to pop up with your name. At least that's not what I've seen. Now that doesn't mean, I think there's maybe some configuration that could be causing that not to happen. I can tell you it does work.
Okay, thanks, Cindy. Hello, 2 questions. First, is it possible to create a totally new customized care guideline? Sue, I think you already answered that one. Yes, it is, right?
Yes.
Correct.
Okay, next. Is it possible to create a new screening questions and attach them to guidelines?
Yes.
Very cool. Okay. I'm also looking in system practice, and I can, sorry, let me reread that. I am also looking in system practice, and I find clinical guidelines, but not clinical guidelines set up. Will I have the same options?
Again, not looking at your system and knowing the version you're on, I would say the likelihood is yes, but I can't answer that, without some caveats. I mean, my answer would be yes. I think you'll have more when you install this. Would you agree? Again, Sue, you're more familiar with the configuration than I am, and Lindsay?
Right. My guess is if you have the upgrade in your system, whether in test or prod, you're going to go to Configuration Home, and it's called Care Guidelines Setup. My guess is if you're not seeing that you don't have the upgraded version, that you're looking at the current version. I could be wrong about that, but it is called Care Guidelines Setup. You can find it if you just go to Configuration Home. If you're not seeing that and you have upgraded, then you need to open a ticket.
Okay, thanks, Sue. Next question: can we build screening questions and attach them to health maintenance guidelines?
My answer to that would be yes.
Great, thanks, Cindy.
Again, some of these questions are pretty generic, so I don't want to give you false hope of something you're trying to do that I maybe don't have the full breadth of what you're asking. But on the surface, yes. And Sue, jump in if you disagree.
That one, I don't have an opinion on that one, Cindy.
Okay, personalized reminders by patient. Does that show for all users or only the users who entered it?
I would think a personalized reminder would only show for the person who entered it, but again, that I would have to test. Just by the name. I don't know that we're far enough into this to have a lot of experience with that to be able to answer unequivocally, but by the name that it's a personalized reminder, I would think it would only show for the person who put it in.
Okay. For recommended guidelines, such as dental visit for diabetic, can this dental CPT build auto complete this? We have dental.
I don't know the answer to that, and I'm not a dental expert. That would be a question best for Nextgen. So I apologize. I just don't know the answer to that.
Okay. If you enter IZ completed elsewhere on a guideline template, does it also update the IZ order module?
I think it takes you there, but I don't think it automatically. I mean,
that is a good question. Are you referring to the order module or to the order management template?
I think it's immunization.
Oh, immunization. I'm sorry, I didn't.
I'm guessing IZ is immunization.
Yeah,
I hope I mean, I could be totally wrong,
yes.
Catherine, and I apologize, but I'm guessing immunization.
I think you're right. I'm going. I don't know what IZ is. Yes, it takes you to the order module. You will place the order in the order module. So yes, it does. Or for immunizations, it does update the order module directly. Yes.
Thank you, Sue. But if you order a lab, you want it to go to the order module that's where you process your labs. So it's not clear what you mean that the order has to be mapped to the vendor. The lab staff pushes the order to the interface when the sample is prepped. So it's a follow-up to the question we were answering earlier.
Yeah, I'm going to try to take this, and then Sue, you'll probably want to add in. Basically, because to use this from the care guidelines. So let's talk about this. You must be using the Nextgen Compendium, and by using the Nextgen Compendium, once you have placed the order and it has gone through, then you have this secondary processing that you're using. And if you're using the compendium, you're already doing this. If you're not using the compendium, you will have to learn to use this, so you probably aren't aware of what we're talking about. But if you want to use the care guidelines to order, I want to make that clear. You don't have to do that. And that doesn't mean that you can't use the care guidelines, but if you want to use the care guidelines and automatically order from the care guidelines, then you have to follow the process by using the Nextgen Compendium. And the compendium is like a big cross-reference tool that maps to LabCorp, to Quest, to Ohio Health, to Rosette, to Orchard, whatever you're using, you have to map your test to that. So there's a two-step process when you're using the compendium, so that once you get it there, then whomever is processing your labs after the provider's ordered it, then it goes out there and then it has to be basically finished. So I guess the best thing to do is that by using the best analogy I could give you is that by using the care guidelines, think about it as a person who's coming up to your door. It knocks, but until you open the door and let it in, it doesn't know where to go.
Right, and the only thing I would add to that then, Catherine, is that if you're ordering currently in the order module and not from one of the templates, from My Plan, or maybe you have a custom template, if you're ordering straight from the order module, right now, this will be different for you because it's going to push it, as Cindy just explained, to, it's called the order, what is it called? Lab radiology processing template. And then from there, you've got to tell it, I want it to go to this lab or this lab or this lab, and that is, and push a button that actually sends it to the order module at that time. So if you're currently ordering straight from the order module, this will be a different workflow for you. If you're not, let's say you're currently ordering from My Plan, then you're fine. Whatever you're doing now, it won't change that. It won't change that because you're already going through that two-step process.
Yeah, and just to clarify, Catherine just clarified, it sounds like the same ordering, or it sounds like the same as ordering in the order module as we do now. The provider only saves the order the lab staff sends.
Yep, that's it. There you got it.
No. Could you ask her, Chelsea? Catherine, are you ordering directly from the order module now?
Yes.
Okay.
It's going to have the
Catherine,
process in mind. I do apologize to everyone. Okay, I've got a hard stop here, so I'm going to have to jump off, so I won't be able to clarify. And I think that maybe, because I see that we've got a lot of other questions, so I'm going to jump off. Lindsay and Sue, you're welcome to continue. And anything that we can't get to, because I see that Catherine still has a lot of questions and there's some of them going back and forth, maybe it would be best if we could, well, I don't want to short circuit anybody, so if anybody else of the people who are still here want to stay on, you're welcome to listen to this conversation. But this might be better to have a quick conversation offline where we could talk about these in a more personalized way. It looks like there's a lot of questions, reasonable questions, by the way, very good questions, but this might be, I don't know if Catherine can raise her hand or whatever, but if she would be willing to have a separate conversation, we could even put like a summary, because it looks like.
Yep, Catherine's going to reach out to you guys independently after the webinar.
Perfect,
because
I think that might be better to have some, I think we would be better to have questions going back and forth, because we're getting into some detail. So if you could skip to the other ones, Chelsea, and I'm going to jump off, everybody. I apologize. I just have another meeting that is starting right now. But I do appreciate everyone being on, and thank you for all your time. It sounds like there's a lot of interest in this. We're really excited about it. And really, don't be afraid to work through it, even if there are some challenges. The feedback we're getting so far is really, really good. So thank you, and Sue and Lindsay, feel free to continue.
Yep, it looks like we just got a few more.
Thank you, Cindy.
Thanks, Cindy. Okay, next question. It actually looks, sorry. So the way that these work is I don't see responses until I get to the bottom of the screen. So it looks like a lot of these are responses to other people, to previous questions. And so, Sean, I'm going to ask the same thing. I see that you were trying to clarify a question that you asked earlier. If you could just shoot a quick email to either Cindy or Lindsay up on the screen, and we'd be happy to clarify the reminder screen question that you had from earlier. Okay, next question is from Terry. Does the care guidelines communicate to procedural history in both directions?
Sue, I'm not sure if you can speak to this better than I can.
I don't know. I don't know. That's something else we'll have to check on.
Okay, Terry, we're going to find that one for follow-up.
Yeah, my understanding is that the care guidelines basically a lot of the features do communicate one way and pull the data and can also be seen as kind of a view-only field. But again, we'd have to look that up.
Okay. Nextgen KBM set up flow sheets to set up metrics. Sue?
I think she's telling us where to set up the metrics. Someone had asked a question earlier about configuring metrics.
Okay. Well, I think that that's all the questions that we have. And again, if we haven't answered your question fully, or if you think of one later or want further clarification, please don't hesitate to reach out to us. I'm Chelsea. I'm going to be sending out an email to everybody later this week with a link to the recordings and the slides. So if you have any questions, then you can reply to that email, or you see Lindsay's and Cindy's information up here. And next week we're going to be sending out more definite answers to those questions that we said we would flag and follow up with later. So please, thank you all for joining us. Don't hesitate to reach out to us with any other questions, clarification, anything like that. Thanks for taking the time to join us today. I know it went longer than expected, but I sincerely hope that y'all found it beneficial. And Sue and Lindsay, thank you so much for your expertise.
Thank you.